Do any of you guys find yourself jumping, facial grimacing, clearing your throats, tongue clicking, or uttering words out of context? Then one of you or all of you may have something called Tourettes. You may ask what Tourette's is. Tourette's is a neurological disorder dealing with the brain that has uncontrollable motions that you may do. A lot of these motions come from something called tics, and there's two kinds of tics, simple and complex. Simple is more of the lighter end of tics, and there's motor and vocal, and motor has to do with the eye blinking and facial grimacing and pretty much anything to do with the face. Vocal is more the throat clearing, sniffing, and then we have complex, which is the higher end of tics, which is worse. And the motor is more jumping, biting, and pretty much hitting yourself. And then we have the vocal, which is uttering words and phrases out of context, which would be cursing and stuff that children pretty much can't control. I decided to do this topic because I wanted to learn more about what my brother has. So I was curious to see how it affects him and what he has to deal with on a daily basis. We're going to talk about the age that it's most common in, how you inherit it, the treatment and diagnosis for this, educational needs that the child needs to go through, and we're also going to talk about what I observed with my brother. Okay. Tourette's is mostly found in children ages 5 to 18, which would be an adult, and most of the children will actually grow out of the Tourette stage. However, if the child does not get it between 5 to 18, there's a high chance that they can get it between their 40s and 50s. It actually affects 200,000 people in the United States right now, all ethnic groups included. And that's actually found in the Tourette Syndrome Association website. And it's inherited through a dominant gene from the parent to the child, and there's a 50% chance that the gene could be passed, so you could receive or inherit Tourette's. Sons are actually 3 to 4 times more likely to receive Tourette's than females. And the symptoms of tics, actually, you could actually have repetitive copying of and erasing of schoolwork. So you'll find yourself just rewriting something and you don't like how it looks, so you'll keep writing it and erasing it, writing and erasing it. You also have repeating of sentences, so you just keep repeating something you say because it's uncontrollable and you don't like the way it sounds, so you also do that. Okay, and the causes of Tourette's aren't fully established yet. There hasn't been a clear-cut way of telling what Tourette's is. And like I said, it has to do with abnormal brain activity. They don't, one side's in balance of the other side. And also to do with the mother's pregnancy. She may be, when she's giving birth, she may have excessive vomiting or nausea, so that affects it. And also the child could be born with a low birth weight, abnormal blood, and or oxygen to the child. And that's found in WebMD. Okay, now we're going to look at the treatment and diagnosis for this. We really can't diagnose Tourette's besides observing the symptoms of the tics I mentioned. So there's no tests like MRIs or CAT scans that you can do to figure out that the child actually has Tourette's. The most common tic is actually the facial tic, which would be the motor tic of the eye blinking and head jerking kind of stuff. Treatment. The best kind of treatment you can do is if you see your child having Tourette's is just to treat it early and get the help he or she needs from the get-go. The behavior of the child can actually be frightening and disruptive, so you'll see your child, the way he may act or the way he says things can actually scare you, but you really can't control it with the tics he has. Medicines can be taken, but there's actually no Tourette medicine. You can take ADHD and compulsive medicines, but they really aren't going to help you, but they can actually calm the child down. Therapy is probably the last choice you can do. You just go see a doctor once or twice a week and help him crush the tics that he may be suffering. Now we'll see the educational aspect. Children that have Tourette's actually have the same IQ range as a child without that doesn't have Tourette's or any other symptoms. So the child that actually does have Tourette's can still become something like an executive of a company or a professional athlete or something like that. Schools can actually help the child with the Tourette's by giving them extra time on a test or giving them the resource room to help them cope with the slowness they may have or the bothersome of the tics that they can't control. All right, now we'll look at my brother here, who actually has Tourette's himself, and he has Tourette's where he does actually repeat himself time and time again because he can't control what he's doing. He says repetitive things like, he'll be like, excuse me, and stuff like washing his hands continuously, and he also won't let us have the volume of the TV on a certain number, because if it's too loud, it bothers his ears, he says, and he'll start screaming and going crazy. Coping with the tics is kind of hard because it gets you frustrated, and there's nothing really you can do besides just accept it and learn to deal with it. So that's how what's up Tourette's is. You can't really do anything with it except learn to cope with it and try to love the child the best you can. Does anyone have any questions?
Now with this disability, are there specific subjects that the child may have like trouble with?
Yeah, the most typical kind of subjects would be like reading, writing, and math.
Is there any cure in the near future or anytime in the future where they'll for Tourette's?
The only thing that they have right now is something for brain stimulation, where you can put a brain stimulator on the child's brain and it can control them. But right now there's nothing else. Anything else?
Are there any famous people who have Tourette's?
Actually, there was Mozart himself who had Tourette's, where he would he actually had trouble uttering obscene words to his cousin Martha, and he would just say uncontrollable things that made no sense, but that was all part of his tics that he had.